Welcome to Concept in Medicine. In today's session, we are going to be looking at the human leukocyte antigen and associated conditions, that's HLA. But first of all, let's talk about what HLA means. HLA stands for human leukocyte antigen, and they refer to genes in the major histocompatibility complex, that is the MHC, that helps code for proteins that differentiate self from non-self. You should remember that the MHC is mostly found in animals. The equivalent of the major histocompatibility complexes in human beings is the human leukocyte antigen. And we said that they help code for proteins that differentiate self from non-self. By so doing, it helps our body to identify the component of itself from other components. So if there's any foreign body in your body, the human leukocyte antigen will be able to help code for proteins that will be able to identify those proteins or those bodies as foreign. So in that case, the human leukocyte antigen plays a role in disease and immune defense. And some of the immune effect has to do with the HLA's association with the complement, the cytotoxic effect of the T cells, and finally the cellular humoral immunity. And you should also know that the HLA plays a role in autoimmunity, meaning that it could account for autoimmune diseases, which we'll be talking about later on with regards to the associated conditions. Now let's move on and talk about the classes of the human leukocyte antigen. So with the classes, we are making reference to three of them. We have the class 1, the class 2, the class 3. The class 1 HLA, that's what we are looking at, the HLA A, B, and C molecules. For the class 2, what are we talking about? That's what we are looking at, the HLA DR, we are looking at HLA DQ, and HLA DP loci. And these class 2 HLA, they can be found on the antigen presenting cells. So you find the class 2 HLA on the antigen presenting cells. Then finally we have the class 3. For the class 3 HLA, they contain genes that codes for proteins with immune function, So that's for the class 3. They code for proteins with immune function. So that will do for the classes of the human leukocyte antigen. That's the HLA. So HLA, DR, DQ, DP, loci, they belong to the class 2 and they can be found on the antigen presenting cell. Then we have the class 1, that's where we are looking at the HLA A, B, and C molecules. So if you have HLA B27, we are referring to what? The class 1. If you have HLA CW6, you are referring to what? The HLA class 1. If you have HLA A3, which is associated with a condition we call hemochromatosis, then you should know that it belongs to class 1 HLA. So take note of that. Now, let's move on and talk about the associated conditions, the HLA and the associated condition. And most of them, as we are looking at, they will be autoimmune disorders. So let's start with the first one. That will be HLA B8. B8 definitely will belong to the class 1 HLA. Which condition are we talking about there? With the condition, simply remember myasthenia gravis. For HLA B8, remember myasthenia gravis, that's MG. So the M will go for myasthenia gravis and the G will go for what? Graves' disease. That's how you remember it. Let's move to the next HLA and the associated condition, and that will be HLA B8 and DR3. The B8 will belong to class 1 HLA and the DR3 will belong to class 2 HLA. With that, you easily remember the condition associated with that combination of HLA B8 and HLA DR3. Remember SAD GMC, SAD General Medical Council, or SAD GMC, the car brand GMC, SAD GMC. So with the SAD GMC, we are referring to the X going to the power 3. That's cubic power of what? X. So with that, we have sarcoidosis, SLE, Sjogren syndrome. Then the A, we are looking at Addison disease, the D, dermatomyositis. Then we come to the GMC, the G will be what? Graves' disease. The M, myasthenia gravis. Then the C will be celiac disease and dermatitis herpetiformis. Let's move on to the next one, which will be HLA DR3, DR2. For that, it will be associated with systemic lupus erythematosus, that is SLE. And next one will be HLA DR3, DR4. If you go into the world of diabetes mellitus type 1 will be the associated condition. The next one you are going to is the HLA CW6. And if you say C, definitely it belongs to class 1 HLA. For the CW6, remember C's is rhyming with what? PS, that's SWA. SWA, 6, SWA. So we will say that for the CW6, the associated condition should be what? Psoriatic vulgaris. Psoriatic vulgaris. That should be the associated condition. Then we'll move to the next one. That will be HLA B27. The moment you hear B, you know that it belongs to class 1 HLA. For the B27, to easily remember, think of pair. So once you think of a pair of trousers, basically you are referring to the word pair. For the pair, the P will go for psoriatic arthritis. We have it here. The A, ankylosing arthritis. The I, inflammatory bowel disease. And the R, Reiter's syndrome, currently known as reactive arthritis, which is characterized by a triad of either uveitis or conjunctivitis plus arthritis plus urethritis. If you have that, that will constitute a triad of reactive arthritis or Reiter's syndrome, where the patient will say that I cannot see, I cannot walk, I cannot pee. That is, I cannot see, you are referring to conjunctivitis or uveitis. I cannot walk, you are referring to arthritis. And I cannot pee, you are referring to urethritis. So for B27, HLA B27, think of PAIR, P-A-I-R, psoriatic arthritis, ankylosing arthritis, inflammatory bowel disease, and reactive arthritis, formerly known as Reiter's syndrome. Let's move to the next HLA and the associated condition. With that, we are looking at HLA DR4 and DR1. The moment you hear DR, we are referring to a class 2 HLA. So with that, simply, the associated condition will be rheumatoid arthritis, RA, rheumatoid arthritis. Then we move to HLA DR5, another class 2 HLA. For that, to easily remember, think of JHAB. For the J, you are thinking of juvenile idiopathic arthritis. The H, you are thinking of Hashimoto thyroiditis. The A, you are thinking of alopecia areata. Then the P, you are thinking of pernicious anemia. And pernicious anemia, that is where there is deficiency of the intrinsic factor. And the intrinsic factor is a glycoprotein produced by the parietal cells of the stomach. They produce the glycoprotein. That's what we call the intrinsic factor. And this intrinsic factor normally binds to what? Vitamin B12 to enhance its absorption at the terminal ileum. And without the intrinsic factor, vitamin B12 cannot be absorbed. That is why if there is deficiency of the vitamin B12, we say that is a megaloblastic anemia. But if there is deficiency of the intrinsic factor, that's the glycoprotein produced by the parietal cells, we refer to that as pernicious anemia. Alright, let's move on to the next HLA and the associated condition, and that will be HLA A3. The moment you hear A3, A means it belongs to class 1 HLA. And HLA A3, to easily remember the condition, it is associated with A3. Think of iron. You can have several oxidation states because it is a transition metal. Now, the two common oxidation states of iron, we have 2 plus and 3 plus. So if you are looking at Fe3 plus and you are talking about A3, then we will connotate it to what? Fe3 plus. And a condition where there is excess of iron site that is depositing into tissues causing damage, we call that hemochromatosis. So HLA A3 is associated with hemochromatosis. Let's move on to the next HLA and associated condition, and that will be HLA B5, B51, B52. They all belong to the class 1 HLA. With the HLA B5, B51, B52, it is associated with the Behçet disease. And for the Behçet disease, it is a rare vasculitic disorder associated with a triad. And what are the components of this triad? We are looking at recurrent oral aphthous ulcers. We are talking about uveitis. And finally, we are talking about genital ulcers. And you should know that for Behçet disease, HLA-B51, it is the strongest genetic factor linked with Behçet disease. With the Behçet disease, as I said, it's a rare vasculitic disorder. With the treatment, the first line of medication for the mild disease will be topical corticosteroids, or we are talking about sucralfate can also be used. But for severe disease, systemic corticosteroids, dapsone, interferon alpha, colchicine, thalidomide, azathioprine can be used. Let's move on to the next HLA and its associated condition. And that is going to be the last one. It's going to be HLA-DR2. For that one, think of GHMN. GHNM, Ghana-man. So G is for Ghana, MN for man. So GHMN. For the G, we are talking about good pasture syndrome. The H, we are thinking of hay fever. The M, multiple sclerosis. And the N, narcolepsy. As you can see, demonstrated there. Narcolepsy. I believe that we've learned something new today, and we have a lot of things to be happy about. Kindly make sure to subscribe to my channel, like, share, and also don't forget to comment the next concept you would like to see on my channel. My name is Dr. Del, and once again, this is Concept in Medicine. Bye-bye.